Okay, hello everyone and welcome. My name is Nicole McGruder and I am the Executive Director of Community Hero Action Group. And today we are here at the 2022 Pennsylvania Black Health Matters Conference, Disrupt and Build Up. And I am pleased to present our next forum, which is Safer Steps. And it is being brought to you by Ms. Maureen Krause of Mainline Health. In this session, you will learn how to stay independent by using strategies that focus on fall prevention. You will learn many of the safety hazards that exist in the home, the importance of exercise, and the other factors that lead to falls. Thank you so much for watching today's forum in advance. And if you have any questions, please feel free to place them in the chat and Maureen will be happy to answer them as she proceeds through today's forum. All right, and I'm going to hand it over to you, Maureen. Thank you.
All right. Thank you, everyone. Thank you for joining in. As Nicole said, the name of the program is Safer Steps. My name is Maureen Krause. I'm the manager of our Community Health and Outreach Department here at Lankenau, which is also a member of the Mainline Health System. I also serve as our injury prevention coordinator for our trauma center. We're a level 2 trauma center. And I will tell you, the majority of what we see are falls. So our goal is to keep you safer, no matter the age. If you think about it, when we were real little, like as a baby, we fell a lot. And as we age, we begin to fall a little bit more. So let's see if we're going to go on. And thank you for bearing with us. So in today's discussion, we're going to discuss the definition of a fall, the fear of falling, because that actually puts it at a higher risk for falling, the risk factors for falling, and actions of what you can do to reduce your fall risk. So what is a fall? Simple. It's an unintentional change in position. You go lying on the ground or on another surface, on the floor, on the chair. I happen to be in a classroom, on bleachers. It includes slips, trips, etc. It's something we don't want to do, all right? It often does lead to injury. Did you know? Just here's some facts. Falls are the leading cause of injury and accidental deaths in persons age 65. 2.5 million older people are treated in the emergency departments. As I said, at our trauma center, it is the number one reason for visits to the trauma center. 700,000 patients a year are hospitalized because of a fall, mainly because of the head or the hip, broken hips, all right? And 1 out of 3 people over 65 falls each year. And part of that is because of what we did not do at a younger age. So this whole fall prevention actually has to start well before we're in our 60s. We certainly can work with it in our 60s, but we want to start getting some of those risk factors under control and things like that while we are approaching the older ages. Fall can change your life, and we don't want that to happen. Prevention. Know your risk factors, change your surroundings, and then the last part is exercise. Increase your muscle strength and improve your balance. And that's what we're going to be talking about today. Now, think about personally. You don't have to answer this to anybody else, but do you ever feel unsteady when you're walking or standing? Best example I can give you is think about when you're walking on ice outside in the wintertime. You know how you have that unsteadiness. Ice is justifiable. We understand that, and you can actually get tracks for your shoes and things like that. But is that carrying through to other, things? Do you find yourself, you're not lifting your foot anymore, you're actually shuffling? They're the ones where you're getting to be a little bit more unsteady. Have you had a fall in the past year? If you've had a fall in the past year, it actually puts you at a higher risk for another fall. Some of that is actually because of the fear that we mentioned just before. We're fearful, so we're more hesitant. In being more hesitant, we're a little bit more cautious, and some of that can make us unsteady there too. Were you hurt during that fall? The more hurt you were, the more fearful you are. And then do you worry about it? Okay. These are all of the reasons that people fall. All right. So let's first talk about a little bit about that cycle of fear. So you had a fall. We fall down. We fell out of bed. Okay. So we're fearful. Oh no, am I going to fall out of bed again tonight? I mean, it's just like riding a bike. You fall off your bike. I'm fearful. If I get back on this bike, I'm going to fall again. What do we tell everybody to do? What do we tell them when they're, we're teaching them on training wheels? Get back on it again. All right. But that fear sometimes limits our activity. That means we do less. I had a woman in a class that fell trying to get onto a SEPTA train. So she refused to take SEPTA trains. She did not drive, and she really enjoyed going into the city. So there were a lot of, issues there that she had to deal with. And then when you limit activity, you have muscle weakness. And the muscle weakness is going to call for even more falls. That's why at the end of this, we're going to do a few exercises all about building up those muscles. Those muscles so much and that are actually going to help me with that fall. So the risk factors. There's physical risk factors. They're ones that changes in your body that can increase your risk for fall. Some of them could be age, some of them could be medication related, could be other activity related. Behavioral risk factors, what are we doing? Things we do or don't do to increase our risk of a fall. And then environmental risk factors, hazards in our home and in your community. And one big one in the community is those sidewalks. When you have the tree in the sidewalk and it just doesn't. And no sidewalk is perfectly level. It would be wonderful if they are in some ways, but that's kind of, it's a cool thing about in an aging neighborhood that everybody's a little bit different, but our brains have to realize that. So, some risk factors, ones that you can't change. Age, sorry, and I would love it, trust me, I would love it, but we are all approaching older ages, okay? And what happens is we lose some of our muscle agility and our muscles get a little bit weaker. We get a little bit more fearful, and our body, I always compare it to as a little baby, you had to build up those muscles. As an adult and an older adult, you have to keep those muscles. But what can you change? One, you can change your home environment, and we're going to talk about that. Your activity level, get out there, walk. Your vision or any hearing problems, which also they are part of the problems that can cause you to fall. Medication use or misuse, sleep patterns, alcohol use or misuse, improper use of assistive devices. All right. You're not using the cane the right way, the walker the right way when you need it. And the choice of shoes. Shoes are so important, and we'll talk a little bit about that. So these are all evidence-based, and these are what we're going to tell you is the ways that you're going to be able to change them. You're getting old when you fall down, you wonder what else you can do while you're down there. All right? Sounds good to me. I can clean up under the couch and everything else when I'm down there. So, some physical risk factors, okay? Your balance. Right? Do you find yourself becoming a little bit off balance? There are some exercises, being up on your tiptoes. It's a great one to build up balance. Standing on one foot with a table in front of you. I have a table right here, my computer's on, with a table in front of you. Excellent for balance. Just walking with your hands out, things like that. Excellent for balance. Muscle weakness, okay? Build up those muscles. How do you build up muscles? By using the muscles. So I'm not just going to tell you the muscles in the leg. I'm also going to tell you your muscles in your arms. Your arms actually are your first defense when you start to fall. Okay, what do? You put your hands down, you put your wrists down, and you're trying to break that fall. So what we'll do is I'm going to tell you lift weights. Go like this, get a water bottle, okay? And just lift weights, it's easier if I don't have one with me, but do biceps, things like that. That's also going to help you because with muscle weakness, sometimes as we're carrying bags in, that's going to impact our balance. So if we have these muscles up here too, it's going to help in our driving, it's going to help in our walking and prevention of falls, but it's also going to help in our everyday activities. Vision problems. Okay, you can control vision problems. Have your eyes checked. If you have cataracts, have them monitored. When it's time to have them removed, get them removed. If you have the beginnings of glaucoma or macular degeneration, things like that, if they run in your family, please go on a regular basis once a year to have your vision checked, because it's so, so important. All right. Circulation. Okay. If you begin to find that you're having, the problems with the circulation, the doctor has told you maybe down your lower ankles, things like that, the peripheral artery disease, things, all of that is going to impact. If you think about anything around your feet, anything around your ankles, is going to impact your fall. So you want to make sure. Sometimes, blood pressure, things like that, which we're going to talk about in a second. Slower reflexes. It just happens, okay? We get a little bit slower at doing things. If I say boo right now, you're all supposed to jump and do things like that. It's going to be a little bit slower than if you were, a 16-year-old or something of that sort. Not that they're not there, not that you can't control them. It's just a little bit slower. So we have to adapt to that. Medication side effects. Medication side effects are actually one of the biggest things that you don't even think about. And my very next slide is about medication side effects. Be aware of them. Read. Your pharmacist is your best friend, because your pharmacist can tell you, and we can talk a little bit about more when medications are interacting. But one of the biggest things that medication can do is it can lower your blood pressure. So many of us, or you've heard so much about, that you take medication to lower high blood pressure. Well, the problem with that is sometimes it has too much of an effect. It lowers it too much. The lower the blood pressure you have, the more dizzy you're going to be, and the more unstable that you're going to be, and you're going to fall. This low blood pressure actually often is the reason why people, when they get up in the middle of the night, older people, when they get up in the middle of the night and they fall out of bed, things like that, like they're trying to get up, but they fell and they break a hip or something. It's because they haven't taken the time to allow that circulation, okay, and that blood pressure to level out. As you lie down, your blood pressure decreases, it levels out. But then as you sit back up, if you sit back up too quickly, you can get dizzy and you possibly faint, things like that. And that's what we don't want. So for medication, the biggest side effect that's going to affect your balance and falls is dizziness. Read what they put on the label. Sometimes reading the inserts is ridiculous. So read what is put on the label. And if it says dizziness, faintness, lightheadedness, anything of that sort, be very, very careful when you're taking it, the day that you're taking it, and what you're going to be doing afterwards. When you're starting a new medication, okay, or changing doses, all right, you can increase it, that increases your risk. It's a change in your body, and your body has to get used to whatever you're putting into it. So sometimes a new medication may not affect my sister, but for me, it's going to have the effect where it makes me lightheaded and it makes me dizzy. That's why it's always good to always use one pharmacy, because as I said before, your pharmacist is actually your best friend. Your pharmacist is going to be able to look at all of the medicines you have when you go to one pharmacy. And I know it's tough with the different prices of drugs and everything, because they're astronomically expensive. But if you can go to one pharmacy, that pharmacist will know everything that they have given you. I've got this for cholesterol, I have this for blood pressure, I have this for an ear infection, I have this for strep throat, whatever it happens to be. And they will know that if you're mixing medications, that's going to that's going to bother your body, and those two medications may not work out well together. So they're going to call the doctor and say, hey, Mrs. Krause is on XYZ. Can you give her something else for her strep throat or for her ear infection or something of that sort? You want to make sure that is, so we're not mixing the multiple medications to have other side effects. Read all the insert and labels as much as you can. The biggest one that's going to be the best one for you is the one that's put right on the outside from the pharmacist. Take with food. Sometimes if you don't take it with food, it can make you very nauseous. Sometimes the nauseous can make you lightheaded. All right. And the nauseous brings it back up and you actually do get sick. And then as you're getting sick, you get lightheaded there too. So you don't want those things to happen. And it's very nice now. Follow those directions. It'll tell you take with food, take with milk. Okay. Do not take with food, take 30 minutes before you eat, all of those things. Follow those directions exactly. And make sure you're taking your medications. Make sure you're taking them. And if you miss one, don't double up on it, especially on something like a blood pressure medication. I always take, let's say, my blood pressure medication at 6:00 at night. I don't remember taking it yesterday, so I'm going to take 2 today. Don't do that, because that is double the amount of medication in my system. It's going to put me at a higher risk for a side effect, and that side effect could easily, especially with blood pressure medication, make me dizzy, fall, things like that. And last but not least, discuss any side effects with your physician, okay? Review your current medications at least once a year. What are you on, okay? What am I doing? Do I still need to take this? If my blood pressure or my cholesterol is under control, can I get off of something? Can I cut it down? And again, if you cut it down, you make that change, you have to understand that that's considered a new medication, all right? Okay. Vision, hearing, and fall risk. Have an annual eye exam, okay, after the age of 50. Ideally, have it yearly, unless the doctor tells you don't need it yearly. When you go there, definitely go to an ophthalmologist or an optometrist, because they can actually, more so the ophthalmologist, can check you for the pressure in your eye for glaucoma. They actually can check the blood vessels in the back of the eye. And the eye is definitely an openness into the rest of the body and what's going on in the body. People who might be experiencing, they found like a mini stroke, they can actually see it from the eyes and things like that. So go to that eye doctor, have that vision checked. Be careful with new prescriptions. Your eyes need time to adjust, especially if they're the bifocals, where you see far away on the top and see lower, up near, close on the bottom. It's very difficult sometimes to adjust to them. So give yourself some time, have your old glasses there too. Wearing the multifocal lenses, you can get 3 now, okay, may blur or distort your vision when looking down. And what do we do when we walk? We look down, okay? We're supposed to be looking in front of us, but most of us, many of us, look down at our feet, which you're gonna find that's not a good way to do. Remove cataracts, okay, because cataracts are gonna cloud the eye. They're going to make it very blurry. So what that's going to do is that it is going to make it nice and crisp and clear for you. Cataract operations anymore are, I hate to say second, but they're just very, very common. It's very common to happen. They do run in families, so there is a genetic link in there. And just go there, have it done, have it removed, and it is a pretty quick, easy recovery from that. And always have your hearing and your ears checked, especially if you have a hearing aid, use that. The reason for hearing, and you don't even think about it with falls, but if you hear something, a siren coming up behind me or somebody running behind me, you're going to react, all right? And we want you to react quickly. Because if not, if somebody is running up behind me, let's say it's little kids or something like that, or somebody's yelling, move out of the way, I need to get over. And if I do it too quickly, I'm going to fall. So you want to make sure this is just a good protective, medicine for yourself at all times. Make sure that you have that hearing checked, and So they're the physical, okay? That's what you can do, that's your body. All right, what can I do? My vision, my hearing, my medications, my muscle, my balance, things like that. Let's talk about some environmental. Environmental can either be in the home, okay, or community safety hazards. Things around the house, things out in the community, okay, cause you to trip. That little cord right there, or clutter. Lots and lots of clutter. I will tell you, it's a bad habit in my house, but I have steps to go upstairs. So where do I put things to go upstairs? At the bottom of the steps. Okay. Well, the person coming down the steps may not see them, may not realize that it's not far enough, and they may trip over that clutter that I've put there. So you have to make sure. And I should also add, just on a side note, that I'm the only one that sees what I put at the bottom of the steps. Everybody else walking upstairs, my husband's children, etc., never see any of that. So just do some makeovers. Do a little bit of makeovers in your home. Easy things to do and very, very cheap and inexpensive. Okay? Make it a safe zone. Clear the clutter. Okay? Clear whatever, you have lying around, things like that. Light it up. Lights are the best thing. Have a light out by your garage, okay? Or have a motion detector out by the back steps, wherever you're coming into the house, okay? Because you're gonna need it to put the key in anyway, but you also need it to walk up those steps to get back into that house. Have a light at the bottom of the steps, have a light at the top of the steps. Have a light as soon as you enter the bathroom or the bedroom, okay? It could be a light switch. You may have the small, inexpensive, actually they have them at health fairs now, things like that, inexpensive night lights, that go on, LED ones, and then they'll go on when it is dark out, okay? So they're not on during the day, things like that. But make sure you have lights available. It is often, if you think about dusk, okay, right before, so when we have a lot of accidents, it's because of how it impacts our vision, that light going down and it's not real dark yet, and our eyes have not, and that's the same thing in a room. Make sure your rooms are lit up. Watch the wires. Don't run extension cords. Don't run, long cords, things like that. Cross rooms. Make sure everything is behind furniture, under a rug, something of that sort. So watch those wires that you're not tripping. A lot of times now, as it gets a little bit warmer, we have the box fans, that we may not want in our window. We may want, out in the middle of our room. So we plug it in, then we draw it so it's like blowing right on us when it's real, real hot in the summertime. Things like that. That's what's going to actually cause, those trips and falls. Toss the throw rugs. I cannot tell you if that's the first thing you do. It's probably one of the best things. We all have throw rugs, all right? You have them in the bathroom. You have them when you walk in your door. You may have them in front of your sink. They're very, very dangerous. A lot of people have them between rooms. They're very, very dangerous. They move a lot. They cause just a little bit of a raised bed type thing, and our foot gets stuck on it. The biggest ones, if you can't toss them, and I understand that too, is make sure, go home, if you're home now, after you're done this, check out your throw rugs. Make sure the back of them are rubber based, okay? Make sure that rubber is there. If you put that throw rug, okay, you toss it in the washing machine and then you toss it in the dryer, the washer and the dryer actually eats away at that rubber on the back that stops it from sliding, especially for the kitchen, especially for the bathroom. Those tile floors, those wet floors, that's where you want to wash those throw rugs. Absolutely be very, very careful with the throw rugs. Install grab bars. They would be in your bathrooms, to help you get up, to help you get out of the shower. I happen to live in an old house and I have, a tub that's pretty deep. Well, climbing out of that tub, because that's where my shower is. I don't have a stand-up shower. So climbing out of that tub, all right? That's where you want the grab bars for. And then last but not least, rethink your shoes, okay? Even flats can be very, very slippery. You always want to have a shoe that has some sort of a tread on the bottom, especially if you have fallen a lot, all right? You don't want that to happen. So I always say, even the slippers that they give here at the patients, they're slide. There's not a lot of tread on the bottom. That tread is what's going to help you grip to that surface, and it's going to help you prevent that fall. So you want to make sure sneakers, best thing in the world out there. If you know you're going somewhere, you're going to be doing a lot of walking, especially if it's someplace that's unfamiliar, like not your house or your family's house, things like that, wear sneakers. Good treads on the bottom, good supportive ones. The other thing with your shoes is make sure they have a back to keep your heel in them, because sometimes we fall off the shoe if the heel is not, secure. Probably the worst things out there in the world, and what do? We all get them, is the flip-flops that you get Old Navy for $1, in the summertime. No tread, and they're very slippery, and you know how your foot has twisted off of them and things like that. Rethink your shoes. Make sure you get, even your sandals can have a little bit of tread, and make sure that they have some sort of a back to them. If you think about the clogs that they wear here in the hospital for, OR and surgical and things like that, they all have a little bit of a back just to come up on the heel so they won't fall off of them. And when you fall off, they're falling off to the side, which can put you at that, it hurts your ankle and puts you at that fall risk. All right. Oh, there's my clutter. Okay, I don't have soccer balls anymore, but there you go. There's the clutter on the steps, and I can see that happening. Okay, hold the rails. Put handrails on both sides of the steps and hold on to them. Use those railings. That's what they're there for. A lot of times we will have at our house only maybe 3 steps going outside, 2 steps, whatever. Oh, it's just 1 step down. I don't need a railing. That's where we tend to fall the most. It's just the little things that you don't even think about. All right. You just get right on the edge of it and you slip. So be careful with that. Put railings on your, and if you go to sell your house, in many communities, you have to put railings on both sides. Put treads on the steps. They're helpful. I know they're not the most attractive things, but if you have hardwood floors, or if you have, you put the treads right in the middle of the steps, be careful because they wear out. If you're outside, you can actually get the treads that have ridges in them, so they're not going to keep the water or anything else. The water will bead off of it, and it's going to make the step a little bit less slippery. One thing I have discovered, because I have them, if you have like wooden steps, like from a deck, or those Trek steps, things like that, when it rains, they get very, very slippery. So again, that's why you need the handrails. That's why you would do that. And then we already talked, install those grab bars on the showers, tubs, and toilets. Okay, there's my grab bars for you. All right, a simple one. This one just latches on. I'm not having to attach anything. If you're moving into a new house or looking, or you're having a bathroom done, yes, you certainly can attach it to the tile, build it right into the tile, but this is just another way to do it, okay? They're found at pharmacy, medical supply stores, things like that, pharmacies, Amazon, okay? They would have that there, and that's going to help you while you're in your tub and while you're getting out of the tub. Use no skid mats in the tubs and showers, and that's a big thing, because why? Because we're always wet when we're coming in that area. Wipe up spills immediately from the floor, okay? Don't wax your floors, and I'm not sure, some people may still wax the floors. That's not something I've done recently. Most tile floors come with it, but understand those tile floors make it very, very slippery. That's why you wipe it up. If something spills on the ground, an ice cube falls out, you drip the water, wipe that up immediately. And wear shoes with non-skid soles. Avoid slippers and going barefoot. I will even tell you, sometimes barefoot is better than going with slippers. We had a woman in a class, our Matter of Balance class. She was in her 70s, and she would not use any, she only wore sandals. They were always open toe sandals. They never had a back. And this is even during this class that we were teaching. And she also believed that she lived in a condo, but she felt she had to change the light bulbs. So she would climb up onto a ladder to change the light bulbs in her kitchen with her sandals on, right? Or she would climb up into a step stool. I just cringed every time she told me that she did those things. So don't do. Take care of yourself. Okay, move it to where you use it. Sounds simple, okay? Keep the items that you use often within reach. Okay, I know I use cereal bowls, salad plates, and dinner plates. All right, they're gonna be right at my arm's reach. I'm just gonna reach them. I know I have big platters, like for turkey, for Thanksgiving, or for the potatoes that I made for Easter, things like that. They are up high. They're up high. I don't use them on a regular basis. So move everything, okay, that you use on a regular basis, and this would include your food too. Move it to the level that is going to be just accessible to you, that you can avoid climbing on stools, ladders, and chairs, or climbing on a stool and then climbing on a counter, because I've seen people do that too. All right. Move it where you use it. Another cool thing, this is a grabber is what they call it. Used to be one of those things that you found on TV. You can now get it at the five and below store. But if it's up there, she wanted this cup, she used her grabber and she reached for it. All right. This is all goes with the assistive devices, the handrails, the raised toilet seats, because that actually helps you if you're down too low on a toilet and you have to get up and you have to push yourself up. That's sometimes hard if there's not a grab bar there or a sink there, something to grab onto. Sturdy shower chairs, handheld nozzle, grabbers. Another real cool thing that you can get from occupational therapy, things like that, is something to help you pull up your socks, okay? Especially after a fall, or if you get very, very lightheaded. It's just something that you can kind of pull. It's a grabber, but it's for socks, and you put the sock over it, then you put your foot in, and then it just pulls it right onto you. So use those assistive devices. Don't be embarrassed. Because what that's allowing you, that's giving you your freedom to continue to live by yourself, to do things, and not have your family and the younger children worried about you. Your home safety checklist, it's real simple. You can get it from www.cdc.gov/injury. This is for older adults, okay? It goes through pretty much everything I did, but as I said, it says for older adults. But think about it, if you start at a younger age and gradually, okay, you don't have to worry about it. Many times we have older adults that want to do everything all at once, okay? And they may not be able to afford it, or maybe they've had that fall and they can't. All right, maybe they had that fall and they can't recover from that hip injury. And we don't want that to happen. So I'm going to tell you, when you get that house, get this, okay? And get out there and make sure your home is safe. Prevention, staying physically active. Get out there and move. It improves your muscles. It makes you stronger. The more you use it, the better it is. Keeps your joints, tendons, and ligaments flexible, okay? Improves your balance. And weight-bearing activities such as walking, climbing steps can slow bone loss. And osteoporosis can set in at a young age. It's osteopenia, what it begins with, and people can develop that in their 30s. And what it is just there's the beginnings of the bones becoming weaker. You can only drink so much calcium, get in so much vitamin D, but I do recommend the calcium and the vitamin D for the osteoporosis. But I also want you to do some of those weight-bearing exercises. I want you to be out there moving and grooving, all right? Climbing, walking. I always challenge people, and this is anyway, I do this with the kids that I teach, is every time that there is a commercial in a show that you are watching, get up from your chair, walk to the farthest room in your house, and walk back and see how many times you can do that during that commercial segment. Sometimes you can have 4 minutes of commercials because they put them all, like you get 15 minutes of the show and then there's 4 minutes of commercials. Do that walk back and forth. What else I tell people to do is have a bottle of water, a small weight, things like that in the chair where you're watching. And during a commercial, do your biceps, okay? Do your triceps like that. So you're actually multitasking, which is phenomenal for you. It's great, okay? But what's key is you're keeping physically active and you're improving those muscles, especially if you haven't used them for a while. So here are some very simple exercises that you can do on a regular. Always check with your doctor first, all right? Now, here are some simple exercises. They're aimed at improving your balance and your lower body strength. Stand on one foot. So literally, I know you see my PowerPoint. Hopefully you'll be able to see me. I have my chair. Always have a supportive thing with you. It could be a chair, it could be a table. And what I want you to do is just stand on one foot. A good time to do this sometimes is at the sink in the kitchen, okay? You got the kitchen sink in front of you and you're just standing there. Just stand there. You're going to hold that position for 10 seconds. You're going to put it down and then you're going to go to the other leg. And you're going to alternate that. What you're doing is you're building up the muscles in the quads and the hamstrings and the quads, okay? And going to build up that strength right there. All right, so that's the first exercise. Easy to do in your house, no problem. You could do that while you're watching TV too. Walking heel to toe. All right, you've all seen it. The TV shows. The police pull them over. Okay, well, that's your balance. Because why? Remember, if you go way back, alcohol does have a huge impact on your balance, but so does not using your muscles. So what I want you to do, hands out to your side, and it said, notice this second bullet, choose a spot ahead of you and focus on it to keep you steady. Meaning, what they don't want you to do is look down. When we look down, we're actually changing our whole balance, all right? So when I tell people when they're walking, I want you to look about 3 to 5 feet in front of you. That does two things. One, it helps your balance. But two, it also allows your eyes to send the message to the brain, and the brain send it down to the ankles and to the feet that's saying, okay, I need to adjust because there is going to be a bump in the sidewalk about that big, so I'm going to have to lift up my foot. So that is a great way for the eyes and the brain and the body to communicate. All right. And this one for walking heel to toe, you just take one step, put your heel just in front of the other toe of your other foot and just keep doing that. You're alternating. All right. You're just alternating. It's one of the best things out there that you can do. All right. Next one. We do tend to be focusing more on the lower body with some of these, is your toe stand. It makes your calves and ankles stronger. If you think about when you walk, your feet and your ankles support your body 24/7. Okay? You're up on that body. Those ankles have got to be strong. Your feet have got to be strong. So your ankles go right into your calves. So a toe stand. Get a good supportive chair, not one that's on wheels, one that is solid, or use a table or a counter. Again, bathroom counter, kitchen counter, things like that. Hold on to it for a solid support to balance like the back of a chair. Stand with your back straight, slightly bend your knees, push up on your tiptoes, hold that, okay? And then lower to the floor and then go back up and repeat that 10 to 15 times. But do that several times a day. It actually is good. I will sometimes, just to stretch myself at work, just get up from my desk and do that. It just adds to, plus it stops with the boredom and things like that. All right. This exercise makes your thigh muscle stronger and decreases knee pain. Knee pain can happen at any age. Knee pain happens at any age. So what is it? It's a leg extension. So you're going to sit back on your chair, with your feet on the floor, okay? Straighten one leg out in front of you as much as possible, and then slowly. So I'm going to have it up a little bit so I could stick my hand underneath my thigh that's that's sitting on the chair. All right, and then I'm going to lower it, and then I'm going to raise it up again, and lower it and raise it up again. It's just a leg extension. And I'm going to do it with the other foot, and then lower it, up, lower, up, lower. And I do that again 10 to 15 times with each leg, building up those thigh muscles, those quads and those hamstrings. They're the ones that you're going to build up there. Oh, excuse me. Tips to remember. Okay. Before we go back, let's a couple for what I'd like to see you do is hand rotations. Okay, because again, the wrist supports. We go to fall, we use our wrist. So just rotations like this. A wrist rotation, make fist. Turn your wrist around clockwise. Turn it around counterclockwise. open and close the hands. Again, simple things that you can easily do at any time. But the more we don't do it, the more it's going to hurt us. Now, tips to remember. Walking is a great way to improve your strength, balance, and endurance. Use a walking stick, okay? I hike, and those walking sticks are the best things out there in the world for me, okay? If you need a walker, use a walker, okay? You're still independent. You're still doing it yourself. Do what you need to do. Tai Chi is phenomenal. It's a good exercise for healthy adults to develop balance. Another one is yoga. That's for more flexibility and things like that. And simple movements and exercises in a swimming pool can also improve your balance. The swimming is not going to build up as far as for the bone mass and bone density, because it's not a weight-bearing exercise, but it is great for balance and building up strength and endurance. Because that's the key. It's flexibility, balance, and endurance is what we are working on. So strength, flexibility, balance, and endurance. All right, start off slow. Always breathe. Remember to breathe slowly when you're exercising. Don't hold your breath. We tend to do it. If you have any sort of a pain, any dizziness, trouble breathing, you immediately want to go to your doctor. This is a big one, and this is a daunting number when you see it. Aim for 150 minutes of exercise a week. That's 30 minutes a day for 5 days, okay? And that can include, you don't have to do it all 30 minutes. You could do 10 minutes, 10 minutes, 10 minutes during a day. And it also includes some muscle strengthening. So if I'm doing some weights while I'm watching TV, again, I'm multitasking, but if I can do that for 10 minutes at a time, right there, I got some of my 30 minutes, a third of my 30 minutes done. Aim for this. If you are not exercising now, don't expect to be exercising 5 days a week, okay? Unless you are very, very motivated. So aim for it. And if you don't make it 1 week, okay, fine. Do it another week. I will tell you, I had whatever the little kids have with the respiratory issue for the past 2 weeks. So I had not done any exercise for 2 weeks, and I just got back on the bike yesterday. Another thing which is not on here, drink water. Drink your water. Keep yourself hydrated wherever you are. Keep yourself hydrated. That's also going to help with your flexibility because your muscles need that water for lubrication. All right. And just in summary, preventing falls. Talk with your healthcare provider, especially if you've been falling a lot. Review your medications with your doctor or pharmacist. Okay, ideally both. Get your vision and hearing checked regularly. Wear rubber-soled comfortable shoes. Eat calcium-rich meals, strong bones. Remove the hazards from your home. Install safety equipment to assist you. And keep moving. Exercise and balance. The tips for Safer Steps are aimed to help you prevent falls and lead to a happier, more independent life. All right? So what I am going to do, all right, Nicole is there. All right, that brings us to the end.
Alrighty, I'm going to take the presentation off. Thank you so much for that.
You're welcome.
I see we are a little stretched for time, but there was one question in regards to glasses from that slide. So do you recommend having 2 sets of glasses instead of the multifocals?
Good question. It depends on the individual person. If a person can get adjusted to the multifocals, because it is very, very challenging to do that, and it does give you that blurriness. But the other problem when you have 2 pairs, you miss a pair, you lose a pair, you gotta switch them. You know, I'm looking far away and I'm doing that. So there's definitely a role out there for multifocals, but while you're getting used to them, have 2 pairs with you, have your old ones with you. Okay. They may not be straight as strong, but have them with you. All right. That
was it.
Awesome.
So I appreciate you all, your help and support for this conference in general. But thanks so much for jumping in and leading the session as well. A lot of great information. For those of you who are watching on Facebook and other social media platforms and may have missed it, we are recording it and it will be uploaded so you can watch it on demand at any time you like throughout the rest of the conference. Then a modified version of it will be uploaded to our YouTube channel. So thank you again, Maureen. Appreciate you.
You're very welcome. Thank you, everyone.
Thanks.
All right.
You have a good afternoon. Bye-bye.
You too. Bye.